New research into Alzheimer's disease suggests healthy lifestyle choices may decrease the risk of dementia, With us now with more on new treatment advances is Dr. Heather Snyder. She's the Senior Director of Medical and Scientific Operations for the Alzheimer's Association. Doctor, thank you for joining us today.
Thanks so much for having me.
So right now, I'm wondering, what do we need to be doing in our current state to reduce our risk of dementia later on?
Well, it's exciting new research that we're seeing here at the Alzheimer's Association's International Conference that looks at combining healthy lifestyle, things like exercise, eating a healthy diet, dark leafy vegetables, those types of food, engaging your brain, staying socially active, not smoking, and then it's really putting those lifestyle factors together. 4 or 5 of them can reduce your risk by up to 60%, but it's okay. Even 2 or 3 can reduce your risk by nearly 40%.
That's really amazing. Those small little changes and sometimes big changes can make that much of an impact. I'm wondering also how close we are to having a blood test for Alzheimer's disease. I heard that that is sort of in the works as well.
As we look there's emerging data that we're seeing here at the conference that is researchers around the world are working to develop a blood test for Alzheimer's and for related dementias. We're closer today than we thought we would be a few years ago, and we're going to continue to see that work go forward. And I think we'll first see it really being used in clinical trials to enroll individuals for a clinical trial and hopefully be able to develop a way to stop or slow the disease.
And why was sleep and the use of sleep medications an important topic at this conference?
Yeah, such an important issue, and we know that sleep is associated with an increased risk for Alzheimer's and related dementia. And new data suggests that it's sleep and also potentially sleep medications that may be impacting risk in later life. The bottom line is that if you have issues with your sleep, have that conversation with your healthcare provider and get ahead of it.
I want to talk a little bit about the Alzheimer's Association in general. I know that it offers a helpline for caregivers and that there's some research about it helping to reduce stress for those caregivers. Can you give us some more information about that?
Absolutely, and the Alzheimer's Association offers a 24-hour, 7-day-a-week helpline, 1-800-272-3900, and one call can be so helpful to a family, to an individual that's experiencing Alzheimer's or related dementia. And new data that's actually being presented here at the conference suggests that it can significantly reduce risk or reduce stress for the caregiver as well. And really putting that plan in place is for care planning so important, and really reach out if this is something that you're experiencing.
I think so many people are experiencing this with their loved ones as they age, so it's nice to know that there's support for them with that hotline they can just call. And then if they want to get more information, should they go to the website or just call that number?
You can call that number for more information. Again, 1-800-272-3900, or go to our website at alz.org.
Wonderful. Dr. Snyder, thank you so much for being here today. Really appreciate it. And we'll be right back with more Midday Maryland right after this. Stay tuned.